Post-traumatic stress disorder is a very common phenomenon. It's double digits percentage of the population suffering from post-traumatic disorder, whether it's civilian-based or military-based. The more common one that we see is civilian-based, and then there are certainly individuals who fall out of the VA system and come our way as well. Trauma can basically be a conflation of a number of different situations, whether it is current in terms of like divorce, for example, or betrayal trauma, or things that have happened in the past, in that first 25 years of life in particular, where the individual is growing their reward systems and trying to determine, in their life what is safe and what is not safe. And what we're talking about here is again, the ACEs score, which is Adverse Childhood Consequence Scores, which is sexual abuse, physical abuse, emotional abuse, and lack of love and lack of structure. And of course, drug use and alcohol use, which come along the way. That first 25 years of life is critical for the development of a person's sense of safety and their emotional tone through the rest of their life. If there is a failure because of the structural environment that the person lives in to actually be able to develop normal coping mechanisms and a normal resilience, then they are certainly at risk of developing post-traumatic stress disorder and have basically increased risk of suffering from mood disorders like depression and anxiety as well. Ketamine has been found to be effective on a number of studies for post-traumatic stress disorders as a way of decreasing a person's sense of fear of harm, decreasing their hypervigilance, and also the ancillary problems that they may face, which include depression, low mood, hedonistic tone problems, meaning just sadness and grief, as well as anxiety as well. And so it plays an integral role in terms of getting the person to a position where they feel safe and comfortable. This is definitely important to utilize these types of therapies in conjunction with psychotherapy, cognitive behavioral therapy, or other types of progressive exposure therapies, EMDR, and a number of other types of somatic therapies that are very effective in incorporating that individual into a safer structural place.